My headline today is from Benzinga. Medical cannabis for chronic pain could cut UK's national health costs by £4 billion annually, improving outcomes. This is by Nina Zdinjak. So new research reveals that allowing medical cannabis to be prescribed through the National Health Service for chronic pain could save £4 billion annually. The research found that when a patient was prescribed medical cannabis for chronic pain, the National Health Service saved £729 per person and improved the person's health outcomes. If medical cannabis were available to the 5.45 million people in the UK with moderately or severely disabling chronic pain, it could save about £4 billion. The savings come from the reduction in the use of other prescriptions, such as opioids, fewer provider visits, and reduced spending on other treatments. The UK National Health Service does not pay for prescription medical cannabis. Essentially, the cost of the medication shifts to the patient. According to Professor Matt Barnes of CIC and Drug Sciences, this seems like an obvious win-win for the government, particularly given the high NHS waiting lists and government funding challenges. Given the government's advocating weight loss drugs paid by the NHS to improve health and boost the economy, our research shows that it should be entirely logical to do the same with medical cannabis, Barnes added. Additionally, the report found that prescribing medical cannabis for chronic pain would reduce the amount of time taken off work annually by 27 hours per patient and increase their individual earnings by £100. Overall, prescribing medical cannabis for chronic pain could boost the economy by £5.45 billion or £1,037 per patient. While it is possible to access medical cannabis through the National Service, it rarely occurs, and only in cases of severe epilepsy, symptoms from chemotherapy, or certain cases of muscle stiffness associated with multiple sclerosis. Despite medical cannabis being legalized in 2018, there are just a handful of patients being prescribed medical cannabis, says James Duckenfield, CEO of Glass Pharma. Glass Pharma is one of the sponsors of this study. We hope that the government will review the evidence in their health economic analysis and adapt their guidelines accordingly. Now is the time to expand the National Health Service provision and allow medical cannabis to be prescribed for chronic pain, said Duckenfield. The study was published in Expert Review of Pharmacoeconomics and Outcomes Research. So this is clearly an industry play to increase bottom line. I think it's deplorable that their argument involves shifting the burden of cost from the government to the patient. On the other hand, cannabis is safer and overall the better option for chronic pain. Trying not to throw the baby out with the bathwater, I would say make it accessible to all. Subsidize the cost so that those who suffer with chronic pain would not also suffer economically. That's civil. After all, it's just a plant, it grows easily in the backyard, and with just a little care and attention, it will reduce the large profits of the pharmaceutical companies and the medical industrial complex, and save the government £4 billion. This is Dr. Jean Talleyrand with High at 9 News.
Dr. T, how did they come up with these numbers?
They calculated how many people have chronic pain in the UK, and then they calculated how much these people who use cannabis go to the hospital, go to see their doctor, get prescription medicines versus people who don't use cannabis with chronic pain. And they made that difference. So it's just some calculation trick. I mean, it's correct.
Okay.
People definitely use prescription medicines less when they use cannabis. And and if their prescription medicines are being subsidized, I don't know why the cannabis shouldn't be subsidized.
I totally agree.
Isn't it true? Isn't it true, Dr. Talleyrand, that most patients will treat pain, even chronic pain, with over-the-counter meds, right? So the over-the-counter market, I would assume, is much bigger than the prescription market for pain, but I don't. I'm just assuming that.
You mean like the over
Like just Tylenol or Advil or aspirin, right?
Yeah, it's in the billions for those. Those are one of the bigger selling drugs out there. And yeah, this is cutting into that, especially NSAIDs, which have these negative effects of gastric bleeding or kidney damage. So,
So
definitely.
Dr. T, on the patients that you see that come in complaining about pain, is it often a clear-cut prescription or not prescription, just clear-cut diagnosis, or not diagnosis, what do I mean to say? Recommendation to first try over-the-counter, like an Advil or an naproxen, something that's over-the-counter, which I guess, I don't know, because it's over-the-counter and it's not prescription, is it safer? Like you say, there could be GI issues associated with these, but based on the patients that you have coming in that are complaining about pain, are you more likely to just say, look, just try some Tylenol or try some aspirin?
I'm more than likely to say try some cannabis. But that I'm and yeah, most patients who come into the doctor have already tried over-the-counter pain relievers. That's where they go first. They go to the drugstore, get their Tylenol or NSAID.
So how successful are the over-the-counter products for treating chronic pain? I mean, I know that, just myself, I could think of, I have a headache. Okay, I'm going to pop a couple ibuprofen, or, my back or my leg hurts. I might take some ibuprofen. Are the over-the-counter medications basically taking care of most of the pain issues?
Yeah, I don't know percentages, but I would say definitely the majority of the pain is treated with over-the-counter medication. And especially these days when they have made opiates sort of the public enemy number one, it really is your only option unless you're going to go down the route of cannabis. But cannabis is safer than those over-the-counter prescriptions. And so that's why I recommend the safer product over Tylenol. By the way, Tylenol works through the endocannabinoid system as well. And so we're dealing with the endocannabinoid system either way, whether it's Tylenol or cannabis.
Yeah, and peripherally, aspirin and ibuprofen are COX-2 inhibitors, right? So they're inhibiting the formation of prostaglandins and leukotrienes and things that are downstream from the arachidonic acid pathway, which technically is connected to the endocannabinoid system, right, Dr. T? Because arachidonic acid is the fatty acid moiety that's in anandamide and 2-AG and stuff like that.
Correct. So all roads lead back to the endocannabinoid system. Isn't that interesting?
Look at that. Mathieu St. Germain, what do you think about that? All roads lead back to the endocannabinoid system.
This is amazing, and I'm learning quite a bit, actually. I really appreciate being on here Friday with the doctors.
Yeah. All roads lead to death.